Hi, my name's Riley Michael. I'm in the 8 a.m. Thursday class, and my topic is osteogenesis imperfecta. What is osteogenesis imperfecta? Well, OI is a genetic disorder which means imperfect bone formation. The disease is characterized by defective synthesis of type 1 collagen. It is one of the most common hereditary bone diseases, with about 20 to 50,000 people in the United States that have it. People with this condition have bones that break easily from very mild trauma or for no reason at all. Etiology. There are 8 different types of OI. OI is usually transmitted as an autosomal dominant trait. However, the type 3 form of OI can very rarely be inherited as an autosomal recessive trait. Types 5 through 8 are both autosomal dominant and autosomal recessive. Mutations in the COL1A1 and COL1A2 genes are responsible for more than 90% of all OI cases. Clinical manifestations. The severity of OI can vary, and some people don't know they have it until they fall and break a bone, with that being the only sign that they have it. Some signs and symptoms of OI include bones that break or fracture with no known cause, bones that break or fracture from minor trauma, bone pain, bone deformity such as scoliosis or bow legs, a blue, purple, or gray tint of the sclera, which are the whites of the eyes, a triangular-shaped face, the loss of hearing, loose joints, brittle teeth, easy skin bruising, very short height, or a sunken or protruding chest wall. Diagnosis. OI can help be diagnosed by looking at family history. Doctors look for the signs and symptoms named before, but may also need different tests done, such as X-rays, which can show the fractures or bone breaks, DNA tests, which can identify the gene mutation, bone biopsies, DEXA scans, which check for bone softening, blood or urine tests to make sure that no other conditions may be causing the symptoms. And then ultrasounds can be done for pregnant women, and they can detect fractures or bone deformities before a baby is born. Treatment. There is no cure for OI. However, there are treatment options available. Some treatment options include casts, splints, and braces for the broken bones, bisphosphonate medicines, dental procedures including teeth capping, physical therapy to help build muscle strength and maintain function, and then surgery can be done to repair a broken bone or fix a deformity, as well as to insert rods which help reduce breaks. And then assistive devices such as wheelchairs may be needed as well. Prevention and complications. Prevention. There is no way to prevent the disease, but there are ways to reduce the bone breaks and fractions by avoiding activities that put them at risk for falling or putting too much stress on the bones, doing low-impact exercises to build muscle strength, such as swimming, physical therapy to build muscle strength and maintain function, and medications that promote bone strengthening and increase the bone density. Some complications of OI include hearing loss, heart failure, respiratory problems and pneumonias due to the chest wall deformities, some central nervous system problems with the brainstem and the spinal cord, just permanent deformities, kidney stones, joint problems, and then eye conditions and vision loss. And then these are my references. And these are my image references. Thank you for listening.